أهلا بكم في تلفزيون CardioAlex. And with us now Dr. David Bach, Professor of Medicine at University of Michigan from the USA. Hi, how are you, Doctor?
I'm very well, thank you.
What do you think about CardioAlex 2017, and is it meeting your expectation?
I think it is extraordinary. I think it's great. I think you've brought together experts from inside Egypt, experts from outside Egypt, and I am very, very impressed and delighted to be here.
Okay, what are you going to present this year?
So I have 4 topics that I'm presenting, all on heart valve disease, and as echocardiography applies to that. Some about aortic stenosis, some about mitral regurgitation.
Okay, what is the most important advance in the field of echocardiography you would describe for the year 2017?
I think that's a little bit hard. I think echocardiography has made advances in 3-dimensional imaging, and honestly just the processing power of the echo machines has gotten better, allowing better depiction of cardiac structure and function. To me, to a large degree, echocardiography is a tool, and it's not really about necessarily how great the tool is, but how well you use the tool.
Okay, how do you think this will affect the routine practice of echocardiography?
I think the more we understand echocardiography and what it can help us learn about the heart, the better we can embrace it and the better we can take care of patients.
Okay. Echocardiography remains an operator-dependent technique. How far do you think the presence of guidelines standardize the practice of this field?
Yeah, that's a very important question. And somebody told me a joke once. They said, "What's the most important thing on an echo report?" And the answer was the name on the bottom, which is really reinforcing what you've said, that it is an operator-dependent technique. I think guidelines are important to help bring people on the same level and hopefully interpreting echoes the same way and taking the information that comes from echo and applying it to their patients. I think we also need to rely a lot on operator experience.
Okay, at the end we would like you to say a word to all the people all around the world about your experience in Egypt, and is it safe and the people to come to visit Egypt?
Yes. I've had a delightful time. I've actually been here in Egypt for 6 days. I spent 4 or 5 days traveling in Luxor and a little south of Luxor and north of Luxor, and now the last couple days in Alexandria. I've loved it. I feel safe. I feel welcome. I think the people of Egypt are some of the nicest, most welcoming people who I've met.
Okay, thanks you a lot, Doctor, and welcome.
Thank you.
Thank you.
I hope that you enjoy and see you next year. Bye-bye.